I'll tell you, on a more positive spin, I mean, speaking to the same kind of thing, we all watched a video from a guy named, what was his name? David Price, I think it was. Is that what you remember?
Yes, Dr. David Price.
Dr. David
Works
Price.
at Cornell Hospital there.
Weill Cornell Medical Center in New York. Now, this video is actually dated a week ago, so it's dated March 22nd, but I didn't see it until more recently. A friend of mine forwarded it to me, and his brother, who's a doctor in New York, apparently had sent it to him. I'd recommend you go out there and watch this particular video because it's very encouraging. This guy in particular is one who's treating a lot of patients who have come into the hospital with coronavirus, and he lays out, number one, some steps that you can take to help to prevent you from getting coronavirus. And he says the primary mode of getting coronavirus is touching something or having contact with someone, like shaking hands or hugging or something like this, where you get the coronavirus onto your hands and then you touch your face. And he says that's really the primary, that this is not aerosolized, that it's not airborne, so to speak, in a significant way. Now, if somebody were to sneeze
in your face,
and you were to sort of inhale their sneeze, then yeah, you've got, and they had coronavirus, then you've got a high chance potentially of contracting it that way. But he did say, if you're just out walking around and you're passing by somebody and they're breathing and you're breathing, that the chances of getting it that way are almost non-existent. That really the way you're getting it is you're touching a surface or a person, and if the person has coronavirus and they've touched that surface and then you touch it and then you touch your face, your eyes, your nose, or your mouth, he says that's the way that people are getting this virus. And to prevent that, he actually recommended wearing masks. But he made the point, this is not wearing the mask because it's keeping you from breathing in the coronavirus. That's not what the mask's purpose is. It's to remind you not to touch your face. So when you've got the mask on, you become more conscious of your face when you reach up to touch it. One, you can't directly access your nose or your mouth. You could still rub your eyes, I guess, but it kind of provides you with the reminder as you reach up to move it aside or something and touch yourself. Oh, yeah, I'm not supposed to be touching my face.
Well, Amy gave me a pair of gloves this morning to remind me not to touch my face, so I put them on. But of course, they were her size. So after my both hands turned purple, I had to take them off. But if you have gloves on, that'll stop you.
Yeah, right. Another good point.
He also said that you do want to wear a medical mask in the instance that you are at home and you have coronavirus, you've tested positive, you have the illness, and you want to protect your family members. That's when you would wear a medical mask.
Yeah, I think anybody who's worried about this virus, who's worried about bringing it home to family members, or if you think you might have a family member who has it, you ought to go out there and just take a few minutes, and it's about a 45-minute video, but I would say within the first 15 minutes, he really lays down a lot of the key points and tips, and then the balance of the video kind of turns into question and answer sort of a thing. So within about 15 to 20 minutes, you can get all the tips that he's got for you. And it's pretty basic stuff, including he tells you when you need to know whether to go to the hospital or not. And that apparently has to do strictly with your difficulty breathing. If you're having trouble breathing, he says go to the hospital. Otherwise, you don't go to the hospital. Even if you've got a fever, you don't automatically go to, or you think you've got the coronavirus or something like that. That doesn't mean you should go to the hospital, because a lot of people can, wait this out at home. I mean, the purpose of a fever, right, is to raise your body temperature for purposes of killing off the virus that's inside your body, because the virus is actually pretty, easy to kill. It can't stand high temperatures. And, of course, we're talking about a temperature differential of like 6 degrees Fahrenheit, which is not all that much temperature, and that's enough to kill the virus off. So this virus is not that tough, and he gets into some of that as well. Of course, it was interesting. He recommends carrying around a bottle of Purell with you, and I'm thinking, when's the last time you've seen one of those around?
I thought the same thing.
Wouldn't it be nice? I mean, if we all had known to stock up on Purell, but by the time we all got wind of it, all the Purell was sold out across the country. So it's not even possible to get any of that. But I had seen somebody the other day with something I thought was kind of a unique workaround. It's not that unique. But they had a little spray bottle with isopropyl alcohol in it, and they were spraying it on their hands. And apparently that would work too. I mean, it gets the alcohol, as long as it's more than 60% alcohol, it gets the alcohol to where it needs to go. So some positive things I thought came out of that video, and he seemed to have, of course, this was a week ago for him, but he's on the front lines. He said he really felt like he'd turned a corner in terms of his level of worry about it, and it was the first day when he did the video that he wasn't essentially deathly afraid of this coronavirus thing and worried himself as a healthcare worker about getting it. But as he sat down to analyze it, he said, there's really a lot of reasons that we now know that this is a lot, as long as you follow certain procedures and you watch how, you touch your face. I mean, that's really the whole key of it. And there you are, Pat George. You're rubbing your forehead. I'm rubbing my forehead.
I just did it. I realized what I did.
Well, you got the lights in here up so high. No, I'm kidding on you.
We had a guest on the show last Friday on Katrina Madewell's show.
Uh-huh.
And he's a guy that actually goes into the ambulance locations and in the ambulance, and he goes into the police departments, and he has a business that cleans everything. He's been doing it for years.
Yeah.
He said this virus is just a wimpy virus to kill. As long as you disinfect and you wash your hands, it's gone.
Yeah.
Instantly. But it does stay on certain things like paper and on, metal for a period of time. And it's very, very contagious, like you've been talking about. Just by breathing it close enough to somebody that has it, you're going to get it. But you can kill it pretty easy before you get it.
Yeah. Well, we're doing everything within our power. And we talked some last week on the show about comparing this to the swine flu, and I guess we'll wait and see where everything all ends up. I do think it's too early to be doing a post-mortem on this situation. In other words, an after-the-fact analysis of what we did wrong, what we maybe could do better. I think it's pretty tough at this point to be doing that because there's so much yet that we don't really know about how this is all going to play out. But there are some reasons, I think, to be hopeful. And certainly, I think if you watch the president's daily briefing, you're going to get a more balanced presentation of what's actually going on. And it's pretty interesting. One, there's a lot of new technologies that are being created to fight this. There's a lot of new production capacity that's being ramped up, including at some of our major manufacturers, to make more things like ventilators. There's a lot more revisions to the models, and we're going to get into some of that revisions, particularly one that Dr. Birx talked about during the briefing on Thursday of last week that I thought was pretty hopeful in terms of the delivery. We'll also talk about what Dr. Fauci said yesterday about total number of deaths, which still seems off the charts compared to where we are today, which is just north of about 2,000 deaths in the U.S. that are related to the coronavirus. Now, one of the interesting things that we've talked about in the past on this show is where some of this hysteria is coming from, and maybe it's good hysteria. In other words, maybe people should be hysterical about this. But some of the things we've talked about in the past were, does the leadership of the country and the states, do they know something we don't know? And I think particularly about what happened in China. So we'll try to cover a little bit of that in some of the time that we have left in the show, but we definitely want to hit on some of the more positive things that have come out about our treatments and ways to deal with the coronavirus.